Uh, as she said, my name is Dina Bayo, and I am going to be doing the workshop or the class today. I'm a little nervous, so forgive me. And I'm an acupuncturist or doctor of Oriental medicine, or Asian medicine is kind of my preferred term. And I've been practicing for about 10 years now. And I work now, I have a business, and then I also work at Casa de Salud in the South Valley. And that's how I came to know of the Kaupuli and this event. So through a coworker and good friend of mine, Lorraine Cordova, who is a nurse practitioner and also a curandera. So yeah, I'm very happy and grateful to be here and to just share all my knowledge and skills with everybody, and of course open it up at the end for any questions or anything else that people want to share. So yeah, I think I'll just go ahead and get started with the PowerPoint presentation that I prepared. At the end, I will also have I have a couple of pre-recorded videos that I prepared. One is talking, like giving examples of different cups that I've used, that I use in my practice all the time, talking about the different reasons why. And then I also recorded a video of a demo on a patient. So I want to share that with everybody too. So we'll start with the PowerPoint, like I mentioned. Did you have a question? Okay. Yeah, and I'm sure everybody has questions, and if everyone, I think with the Zoom kind of etiquette, if you want to say that we've all, or a lot of us have gotten accustomed to, if people can mute themselves and then save your questions till the end. And I'll be mindful too about my time to give a good amount of time at the end so that people can have plenty of time to ask away. So, thank you. Okay, can everybody see the slides or the presentation here? And if you can't, I can't visually see you anymore, but you can go ahead and share in the chat box in the messages that you're having trouble with it. So that first slide, it passed already, but that's fine. Just talking about the presentation, the name of it, which is Historia. Oh, thank you. So the name of the workshop that I called it today is Terapia con Ventosas, which is another word for cupping. So cupping therapy and the Historia, Cultura, and Familia by me, Dina Bayo, as I mentioned. So yeah, there's a couple of pictures that I have on my website here of cupping in action here. Thank you. Yeah, we could keep going. Yeah. And here is an agenda just for today. I think we'll have time to get through the whole agenda here, but just if y'all want to have an idea of kind of the things that I'm going to go through today. So, introduction first, which is kind of introducing a little bit more of myself and what I do and why I do what I do. Definitions, common questions, and meanings around ventosas or cups or cupping therapy. And then I'm going to go into an historia or history of ventosas or cupping. And then I also want to talk about kind of like the duality, what I call a duality of experience with like melding the professional and the personal, as I'm sure many of us have that experience, but I wanted to share just a little bit more of like my personal experience as a Chicana, as someone who is in a field that's predominantly white, predominantly a lot of times male, or whether it be female, but just a different field than I am used to. And just a little bit more sharing of my personal journey with that. and also my professional one too. Then near the end, I wanted to share, as I mentioned, a video, like a demo on cupping, and explain why we do certain things with different types of cups. And then I will end with just asking for questions or for sharing of any personal history, or like as in our families, or Cultura. Just I want to be able to give that space to people. Okay, and then the next part here, I will just talk about who I am a little bit more. If you read the bio for, or the description for the workshop, this is kind of based off of that, but I just, I just changed like the perspective of, instead of third person, I'm talking more from I perspective. So, just my name. My name is Dina Bello. I'm a Chicana. I was born and raised in Southern California, in a small town called Oxnard, and I've been in practice, private practice for acupuncture and Chinese medicine for almost 10 years now. I've lived in Albuquerque and considered New Mexico my second home for many years now. And I have a lot of siblings, a lot of nephews and nieces. A lot of my friends and family live here in New Mexico, but many of them also live all over the country. And the reason I came into this medicine is because I was really unhappy and frustrated with how I saw the care for my grandmother go over 12 years ago. And so I was just left feeling with that there had to be another way. And shortly after that, a friend of mine actually told me about acupuncture and Chinese medicine, and that's what led me to New Mexico and to study here. And I haven't really looked back. So it's been a very beautiful, mostly beautiful journey for me personally. And I live out here with my husband and our 3 dogs, Chaco, Emiliano, and Pancha. And so that's just a little bit more about myself. And there's some pictures of us, just to give you an idea. And then now I wanted to talk and go into more about cupping, more like the definitions and different meanings, like kind of common meanings, and also a lot of questions that I personally get from people, but also questions that you might have, or questions that you might not have thought of, but just kind of going into that. Okay, we could go to, yeah, thank you. So here I'm going to talk about kind of these specific questions, like what are ventosas, what are cups, what's cupping therapy, also known as CT. So ventosas, or fire or glass cupping therapy, uses primarily like a suction type of action. This can be used with many different types of like cylindrical type objects, and these can include things like jars, cups, other materials other than glass also. I love the word ventosas. I think to me it also like just, I've also heard people kind of associate it more with like the wind also. And to me, coming from a Chinese medicine background also, it makes a lot of sense, because in Chinese medicine, the wind can be kind of like very pathogenic of a force. So it can be a good force, but it can also be something that can create not good stuff in our body if we don't do something with it. And so then many Latinx people have a story or a memory with the family member treating them or someone else in their family with ventosas. And then so cupping therapy, or CT as it's referred to, is very similar to ventosas. It just uses suction therapy, and it's mostly attributed to the country of China and many countries surrounding it. So actually, in Tabitha, I wanted to stop here maybe, because I'm kind of feeling like maybe I wanted to open it up a little bit, if that's okay. Maybe we could stop the screen sharing and just see how people are feeling with just where, if they have any questions. I know I said save questions till the end, but I just am going through it and I'm thinking, well, it's kind of, we still have a good amount of slides to go through, and I don't want it to just be me talking, I guess. So I did want to open it up to just people right now, see if anybody has anything to say or anything to share at this point.
Just thankful that you're sharing yourself with us. Thanks, Dina.
Oh, yes, of course. Thank you.
And I am interested in what you're talking about wind and the kind of both parts of the wind, or what, just learning more about that.
Okay. Thank you. Does anybody have anything, any other comments or any other questions before I can address that right now too, because I think it's fascinating too. Cool. Well, okay, well, if it's okay with everybody, I'll just keep going, and then I'll talk a little bit more about wind here before I keep going with the next slide.
Did you want to start with this one or the one before?
This one that you're on is good here. Thank you. Awesome. Okay, great. Thank you. So yeah, I'm glad that you brought that up, Aviva, I believe, about wind, and I am also fascinated by it because like I said, a lot of things related to wind can be considered like pathogenic in Chinese medicine or not considered healthy. And a lot of things really, they make sense really with what we consider wind in the body, like what we consider maybe like a kind of liver wind pattern is one common thing that we can see that usually is translated to like people having like what can naturally be seen as wind in the body, which is usually like shaking, tremors. It can also be things like when people have Bell's palsy, you know, like a paralysis, or what can be seen as like a nerve impingement, or paralysis is the better word for it, but like on one side of their face usually, or muscle kinds of issues that, you know, have to do with like moving types of issues like tremors or spasms that also can be related to wind. Like also when people have like strokes also, it can be complicated, but wind can be a factor in there too, as well as like convulsions, or when people sometimes they have things like Tourette's syndrome, which is usually something that kids have, but that's usually what we'll see is like either a deficiency leading to wind kind of taking over, or sometimes a congenital, or maybe something that they're born with, but it's exacerbated or worsened with either wind type factors, whether they have to do with like the actual environmental wind, or like it can also have to do with like food also, or stress, or environmental factors such as like chemicals, or, you know, other things like that. So it can be really, it could be simple in some ways, and it can get very complicated in other ways. So that makes sense. And that's all. The other thing that I'll talk about with wind that I think is a really good thing for everyone to kind of keep in mind is in the back of our heads, like our nape area is a really good area to protect. In Chinese medicine, we consider that like kind of the wind gate area, like a gate, like an open, you know, open fence or gate area. And I always recommend to folks, especially when it's windy outside, to cover up with the scarf or any kind of covering, because things can enter our bodies in that area according to Chinese medicine. And I think it's not just Chinese medicine, but a lot of indigenous or traditional cultures that view that as a susceptible area. And then I'm looking at your question. I think I'm not exactly sure of the material that is being used on his back, but I do believe it is bamboo. I agree with that. It is a little bit darker, the bark, but I think that's traditionally what a lot of Asian cultures will use, like when it comes to like wood type material. So I do think it's bamboo, but I'm not sure. And then the susceptible area, okay, yeah, that I was talking about, that's really good for everyone to cover up usually, especially if you know it's windy, but any type of cold weather, I would say. And this goes regardless of whether it's cold or not, but just any type of wind, is in the back of your neck, like the nape area. So I just always carry a scarf myself in the car, lighter, you know, because if it's warmer weather, you don't want to be too warm. But yeah, it's a really, really good, I give that advice to almost everybody that comes through my door. So just to cover up and kind of protect that susceptible area that most of us have to some degree. So yeah, I hope you enjoyed that little segue. I can talk all day on all that type of stuff, but yeah, we'll keep going with the slides here. So this, oh yeah, if you can just go back, sorry, real quick, I'll just cover all this on the Ventosas and cupping therapy. I just compiled a list there where I kind of looked at different like curandera articles and websites. We have a really, really great resource here at UNM with the curandera course that they have. And then of course, there's just so much here in New Mexico. But I compiled a list of kind of common treatment benefits that can come from both doing ventosas, if you're looking at it more kind of from a curanderismo or traditional viewpoint, and then also from more of a cupping kind of therapy viewpoint, which is kind of not different, but I think a lot of times they're seen as very different now. So some of those things are musculoskeletal issues such as pain or tenderness, achiness, colds, viruses, or other sickness. Emotional issues are also very common to treat, like you can on what we call the dew or the bladder meridians on the back. The outer lines especially, there's like 2 lines that go along the spinal area. And the outer lines especially are more related or correlated with emotional issues, to either help release or to help express or to just help with, you know, any kind of things that might be trapped or blocked. So I included in there stress, anxiety, grief, or sadness, or anger, frustration, just as a few examples, but there's so many more emotions that we don't address a lot of times either. And then another thing that they're both commonly used for is moving qi, or to help with blood circulation, whether it has to do with like maybe recent injuries or more old injuries, like what we call stagnant old blood, can help bring it up all to the surface here. And then you can also improve your energy, digestion. There's a lot of abdominal area points, or what we call mirror points in the back also, that can also help with digestion, or abdominal points, vice versa, using that mirror kind of methodology. You could treat the abdomen to treat the back, or you can treat the back to treat the abdomen. Both are very powerful and both very therapeutic. So I do that a lot too. And then we can go to the next one here when you're ready. And then these next couple pictures or slides here are more just kind of talking about, from a Chinese medicine perspective, based on meridians and the organ, like anatomical organ placement and energetics, you can say, or also like how we see the organs like playing their role with the meridians and the channels that we see in Chinese medicine. So that's probably a lot of information there for a lot of people, but I just wanted to include that because that's where I'm coming from a lot with my studies and my schooling here. Okay, and then on this next part, I wanted to talk a bit about the history or Historia de Ventosas. There's a big history, just depending on how you see history, right? Okay, here I have a picture of a medicine man from a tribe in Africa that I apologize, I'm not sure. I think it's Western Africa, but this picture that I got online didn't have a lot of information, you know, citing what exactly, where exactly it was from and what tribe. So I apologize, I don't have much more information other than that. But medicine men or medicine women or shamans, as they're also known as throughout the world, there's many indigenous or traditional cultures or communities that have this tradition and therapy in their repertoire. So this is a picture of someone, a medicine man, most likely doing therapy, suction therapy with what's probably most likely animal or buffalo horns. And rather than using, you know, the suction methodology, which is usually done with like, you know, taking oxygen out of that area and placing it on somebody's skin quickly enough so that the oxygen, when you lose it, is what creates the suction. What they used to do, they're finding more and more, is people would actually create that suction by sucking themselves with their mouth, you know. So that's a picture of that, and I think it's very fascinating too. So I wanted to show that. And let's see, this next quote, it's a long quote, so I won't read it all. But there are a few people throughout the world, you know, that are considered to be like experts, you can say, or researchers that do a little bit more, or a lot more, I could say, than just what our institutions or schools teach us. And it really is really dependent on how much you want to, how far you want to take it, right? Or how much you want to learn with these specific modalities that were kind of brushed on a superficial level, you can say, with a lot of our schooling, technical schooling. So we learn the basics, but it's really up to us how much more we want to do. For some reason, this one is kind of blurry, the slide tab at this. Maybe I'll just wait a bit for it to focus. Oh, here we go. Okay. So this quote is from a man who is from Australia, and he teaches different cupping courses around the world. So it's actually really cool, you know, what he does. He's an Australian guy, and I actually took a class from him. So that's why I wanted to mention some of the work that he does, because, well, it's like with the caveat a little bit. So I'll read this quote. I'll read most of it here. So he says, for example, natives along the west coast of North America in the vicinity of Vancouver Island used shells. In Europe, Asia, Africa, and North America, hollow animal horns were fashioned to provide an effective cupping device. In North America, the natives made their cupping implements by slicing off the point of a buffalo horn. They would then place the base of the horn on the body and suck the air out through the opening at the tip. When a vacuum was achieved, a wad of dried grass would be immediately thrust into the opening by the nimble workings of the tongue. By this method, the medicine men, with their powerful facial muscles and considerable agility, can make a very successful job of cupping. And then the rest of it is talking kind of a little bit more about that, and how people found this information out, which, they're saying a lot of it was inscribed into clay tablets, and talks about the ages of, and the history of a lot of these practices. So as I mentioned, this is a white man from Australia that I actually really respect and admire him, and I learned a lot from his workshop. But I wanted to bring this up as kind of just an example of just how the field is, and just as we know, the world in a lot of ways. As much as I do admire and respect his work, and I do think he places a lot of importance on indigenous and native knowledges. To me, sometimes when I think about the facts that who are considered experts, when a lot of this is passed on, via indigenous oral knowledge, sometimes it is frustrating to know that the people that are considered experts are, a lot of white men. So that's the main reason I wanted to include this. In kind of two fashions of including it, because it is really good work and a lot of research and respect I think he's placed into putting out this information to the world. There's also kind of like the double-edged sword, I think, with kind of knowing that other part that I mentioned is part of it also. So I hope that makes sense. And like I said, I do deeply respect and admire him, but it is the kind of the caveat with that. And then I can go on to the next slide, where I'm going to quote somebody else. Her name is Anna Dinalo. I'm not actually sure what her background is, or ethnicity, but I thought it was really cool that I found this article from her. It's a journal article, and I have all my resources and links at the end for people if you're interested in getting any of it. But I really thought this one was cool because it's an official article in a journal. She's a woman. Like I said, I'm not sure what her background ethnically is, or her heritage, but she was published here at the University of New Mexico. So I thought that was really, really cool. So I wanted to include her quote also, because she has a lot of cool things to say. So kind of just contrasting the two resources that I used here for the history on cupping here. And then while that's focusing for me, because it's a little blurry also for me now, but I'll just talk a little bit about the picture here. And this one also, I apologize that I don't have much more information other than that this is most likely a shaman or a medicine person of this community, doing some type of suction therapy also with via the mouth. So I'm going to go ahead and read this here. So throughout history, cupping techniques and styles have often resembled the geographic locations they were practiced in, as well as utilizing a region's local materials. Animal horns, bamboo, ceramic, glass, metal, and plastic have all been used in this practice, found in ancient Egyptian, Chinese, Unani, Korean, Tibetan, and Latin American cultures, all of which have served the purpose of supporting the body's ability to heal itself. In North Africa, cupping therapy was first documented on Eber's papyrus around 1550 BCE, where a cup is the Egyptian glyph to reference a physician. In Asia, during the Jin dynasty, Ge Hong, which he was around 281 to 341 CE, mentions the use of animal horns as a mean of draining fluids from the body. In Arabic and Islamic countries, cups, hijama, as they're known as, are recommended in the Al-Kanan's field tea, Canon of medicine, which is from 1225 CE, to treat menstrual conditions. So So as you can hear and read, there's like a really, really extensive, long, thousands of years history that's not only been known, but documented, in a lot of written documents. So I think that's really cool. So I wanted to share that too. Okay, and then this next part is what I had mentioned before about just kind of talking about my, what I call like a duality experience, which is like a melding of the professional and the personal, which in my like last like 10 years, I have always really tried to keep separate, as I'm sure many of us have, but maybe recently in the last year or so, or a little bit longer, I've decided that I no longer want to do that so much as I have felt forced to in the past. And so I'll just share a little bit of that here. And I hope people can relate a little bit. Okay, and so here's a picture of some more what I believe are bamboo cups, just very cylindrical and not as round, but more kind of like tall shaped. And so in my experience, I have found that many patients and people in general who do not identify with white or mainstream American, Canadian, British, or Australian cultures, they have a more kind of close and personal, often ancestral connection with Ventosas and cupping therapy. I often hear many Latinx folks specifically recall an instance or a memory of their tia or abuelo or abuela treating them or maybe another family member with Ventosas when they were sick maybe or had an injury. It's not everybody, of course, because I mean, just as often as I hear people telling me that, there's some other people that will tell me stuff like, oh no, I don't have any memories of that at all, or like, I don't think my family did that kind of stuff, or the only thing, the only cupping stuff I've ever heard or recalled hearing about is like on TV or the Olympics, things like that. So I don't mean to generalize ever with anybody, but just kind of my experience. So. And here I'll talk a little bit more about like my personal experience, and then just kind of why it fuels, I guess, what I do here. So as a Chicana and a first generation born from Mexicano immigrants, I have had a challenging and fruitful journey, to say the least. So throughout like my entire educational experience in formal and informal settings and institutions, I feel like I've dealt with both microaggressions my entire life, as well as outright racist, sexist, patriarchal, colonial, dismissive, demeaning attitudes and beliefs, not only from white people, but from other Mexicanos, other women, other brown BIPOC folks, my elders, many people I've called friends and family over the years. So just kind of like that toxic colonial attitude that I think we all have to work on, because we've all probably have some of it that we've breathed in, that toxicity to some degree, and myself included, of course. So I mention this too because I like to say it's both fueled and stamped out at times, a lot of my fire and tenacity, my enthusiasm and my work, my love for my work and my profession over the years. There have been times that I feel like I want to give up, or not do what I do. Then there are other times I feel like this is what feeds me, I mention that too because I hear a lot of kind of very similar things with patients that come through my door, and I never try to like project, what I'm going through with them. I always try to maintain those boundaries and professional professionalism, but at the same time, sometimes I can't help but feel like, wow, like a lot of us are in this struggle together and we don't realize until we share what we're going through. And so I'm grateful. I have so much gratitude that I'm where I'm at, that people trust me and open up to me so much as they do. So anyway, so back to this. I love to meet and learn from people who have a similar background as me, or people that I know who have struggled like me, and people that remind me of my family and my community in Oxnard and in Albuquerque. And this is why I love to work on a team and collaborate with others. I like to work on my own too, and just ensure with everybody we have our days. But I also love to work and talk about people, patients with other people that I know that have more of a Western viewpoint too, and come together. I mean, I really do think that this is what the future of what we call integrative medicine is. So I work at a clinic in in the South Valley in Albuquerque here called Casa de Salud. And this is what I feel like I do there, is working on a team and collaborating with others is what my biggest passions is. And I also, I'm informed a lot by my past work as a community organizer and doing community work, organizing work, activism work in both Northern and Southern California. And this is what reminds me of why I do the work that I do. So just wanted to share a bit about that too. Okay, great. And then Tabitha, for this next part, I have a video. Would you rather, can I play it just from my iPad here, or should I send you the file? Would that be easier? Sorry, I should have worked that out before.
It might be quicker if I believe your co-host right now, and you should be able to
Just play
share
it.
the screen. Yeah.
Okay, awesome. I will do that here. Let's see.
Or if you have the file, Andy, you can send it to me as well, whichever is easier for you.
Okay. If I can just see if I can screen share, I can just do that real quick here.
Awesome. Okay.
Okay.
In the meantime, I'm going to put Dina's Cash App and Venmo information if you'd like to give any donations.
Tabitha, can you hear me?
I can now.
Okay. I am not able to figure out how to screen share right now. So I'm gonna just go ahead and share the videos with you. It's 2 of them.
Okay, sounds great.
Okay. you can't hear me, right? There should just be, okay. Can you hear me now? Okay. Yeah, sorry about that. I thought there was like a screen share button on here that I'm not finding, because I don't see that. It's not allowing me to send you the videos. But you know what, it's okay. I'll work around it. I brought one of the videos was like a demo showing cups, different sizes, the different types that I have. And then the other video was like a demonstration video. They were both very short, but since it's technical difficulty with sharing them, I can just show you here with the cups that I have and kind of do what I had done in the video. So we'll do that. Can everybody see and hear me okay? Okay. Thank you for being patient. All right. I didn't bring my buffalo horn. I do have a buffalo horn at my clinic, but what I did bring was my fire cups, and which are the glass cups, and silicone cups also. Okay, so these are fire cups. I don't know if people are too familiar with them, but these are like what's considered fire or traditional or glass cups. The reason they're called the fire cups is because the traditional way of using them is you light a cotton, you soak a cotton ball with alcohol usually, you put it at the end of a forceps, and then you're usually wanting to be pretty close to a person's body when you're doing this. You take out the forceps with the oxygen and the flame, or the flame with the cotton ball, and the removal of the oxygen in that area, the suction, is what usually creates the suction. You use different sizes too, as you can probably guess, depending on kind of the anatomy and the area of the body that you're working with, but also, just based on if you want to cover just maybe a point, or you want to do what would consider like flash cupping, like where you're leaving it for just an instant, then you're taking it off and then you're putting it back and kind of doing that type of motion. So there's also what we consider like moving or gliding cupping. And I did this on the video, so I apologize. We'll have to just imagine it together. And so one of the big reasons I love to use fire cupping versus the silicone cupping is because, as you can imagine, that fire action is like a warming action into the body. So when I see that people have a lot of like cold in their body, what we also can translate it as like yang deficiency in Chinese medicine, the fire or that warmth, that added warmth, is really, really good for people that have that cold in their body. So we're like putting that warmth back into them in that way. So, and similar to just thinking about where you want to put the cups, if you know that like kind of their weaker areas or deficient areas of their body are like where cold maybe can enter, or different temperatures, how we see a lot of things in Chinese medicine or traditionally. That's a reason why you might want to put it in different areas of the body. Like if they have a really cold abdomen, or different parts of their abdomen is really cold versus a different area, that's another good reason why you want to put like a bigger cup there, or add maybe extra warmth to that area. Okay, and then the cups here, let me see real quick. Sorry, there was a question, I believe. And I believe it's, so can you get a blood clot from the cupping is what I'm assuming that the question is about. Is that right?
Yeah. That's correct. Like too much suction, creating some sort of like, break in the blood, in the skin. Like a hit. Yeah.
Yeah.
The dangers
well,
of it.
I think there is a danger if you leave the cups on for too long. You know, if you leave them on for longer than 20 to 30 minutes, that's probably usually too long for some people. We look at things like deficiencies and excesses of people's bodies or constitutions a lot. So if someone has kind of like a weaker or more deficient constitution, you don't want to leave the cups on for very long. In terms of a blood clot though, I can't really say I've ever heard of that, and I don't think that this can cause that. But it causes what's called, like in Western medicine, like petechia, you know, or like blood coming up to the surface, or blood vessels breaking, and you can look at it like that too. So I would think that it's more of the opposite, like you're breaking stuff up, but I would just be cautious of leaving the cups on, especially with little to no experience, you know, for longer than 5 to 10 minutes. But I have never personally heard of a blood clot being caused by cups, but I'm not saying that that's not, that hasn't happened. I just have not heard of it personally.
Thank you very much. That answered my question. Thank you.
Yeah, of course. You're welcome. And then I'm going to answer another question before I go on to more of the silicone cups here. This question is from Maxine. Can you cup any area? For example, I have RA and my knee area is often painful. RA, I'm assuming you're referring to rheumatoid arthritis. Yes, you can cup any area, especially I would recommend these for you. And these are really, I recommend them to lots of people because of the fact that you don't need the fire with it. You don't need a lot of training with it. And the way that these work is literally by pushing on the top here, and that's what creates the suction. What I would recommend for you is, or for anyone that's interested in purchasing these types of silicone material cups, is just purchasing oil to go along with it. So if you're gonna wanna use it around the knee area, you know, so pretend this is like, the elbow can be seen as the upper knee, right? So you wanna put oil around the knee area. And depending on if you have it like more the inner part or the medial part of your knee versus the outer part, the back of your knee, wherever, you want to apply the oil to all those regions. And then these cups, I'm not giving a good example because I don't have oil right now, but with the oil really, really helps to help the gliding aspect. And I would do a combination of leaving it like on the skin there, like creating the suction, so, and then you can move even your knee with them on, and then a combination of leaving them stationary and then also gliding along the regions where you feel a lot of your pain. So that's what I would recommend. So yeah, so the silicone cups here, they run about maybe $40 to $50 for a set of 4. So I really think that's really affordable and good quality, especially for people that for patients that come and they're either coming from like a area where they have to travel a good amount. So like fees, you know, asking them to come every week, or, you know, frequent treatments is not very feasible. Or if like they can't afford, you know, coming very regularly and they have conditions that might require them to need frequent treatments. I recommend this to a lot of people that are in those types of situations, because like I mentioned, they're very easy to use. A lot of times you don't even need like another person like you might need with like these types of cups, you know? I mean, these cups are easy to use, I think, if you have training, but with fire, I think people get a little wary. And also these aren't easy to use like on the back area, you know, you can't reach certain areas. Versus these, depending on how flexible you are, if you can, I've had different things go out kind of in different parts of my back, and I stick one of these on here and walk around with it, and it helps a lot. So I generally like to give people that advice that if you can have a set of these at home, it's really great. In the demo that I didn't get to show you all, I did my husband's back, and I did kind of like along the bladder meridian in the back and shoulder area. I really like to demonstrate how these, you can use them on the shoulder especially, and see how I can move it around my whole joint, and the cup, it doesn't affect it coming off, versus if we had a glass one on there like that, it most likely would pop off. So you could do this with your knee too, or any other joint. You can treat things on the bottom of the foot too, and just bony areas that you can't really treat with the glass cups. So these are like my favorite for a lot of those types of things, and for those reasons there. So that's my demo there that I kind of improvised live. Thank you for sticking through everything with me, and I'll open it up again to any questions that people have. Oh, okay, sorry, I just saw this last question here that is there anywhere where you should not do ventosas? That's a really good question, thank you. Yeah, there definitely good big cautions are like to not do on an area that's like a fresh or a new cut or burn or abrasion, somewhere where you can probably most likely get an infection, you know, if you bring out more blood from that area or bring up more circulation to that area. So you want to avoid areas like that. Probably also like rashes, active rashes, you want to avoid those areas also. Hair, you know, hair sometimes can get in the way, but I've even done with these like in the back of the neck, you know, kind of this area here. For a lot of people, you have chronic neck and shoulder tension that can reach up to there. People get headaches often. So hair can sometimes be a factor of places you want to avoid, but it's not necessarily always. But yeah, you do want to probably, excuse me, you do want to avoid areas with active like open cuts for sure, and rashes, things like that. Excuse me. Here's another question about using it for excuse me, mental health issues. I did mention earlier, but I don't know if everybody, excuse me, let me drink some more water. I just kind of mentioned it really quick, but I do treat a lot of like stress and anxiety, and especially in the pandemic, of course, it's a huge, huge thing. So in the back area, it's what we consider the urinary bladder meridian, goes along the spine, and they're kind of like maybe an inch or two outside of the spine. And then there's an outer line of the same meridian. That outer line, I often use it for emotional issues, like repressed issues, or seasonally too, like in Chinese medicine, every organ kind of is in charge of a different season, which is also kind of like an emotion rules that season. So right now in the fall or the autumn, sadness or grief is kind of what rules this season, which is why, you know, it makes sense with a lot of people, their depression might get really severe around this time, or sadness, you know, the sadness of seasonal affective disorder can be very predominant in these seasons too. So that outer meridian, the outer bladder meridian, is say like the lung especially, that has a lot to do with grief, with sadness. And a lot of times when people have had either, you know, people that have passed away in the past, anniversaries that come up, this can be a really, really strong, severe season for things like emotional issues like that. So I do treat a lot of that. And I will primarily go along those lines there to treat those like kind of trapped or repressed emotional issues. And also this area too in the front, this chest area, is really important to treat for those types of issues also, for women and men especially, but a lot of women, if we don't address this area, things can you know, progress and not be good in the future for many of us. Did that make sense? Sometimes.
Yes, thank you. That was awesome. Really wonderful explanation. I appreciate you.
Great, thank you. Let me just check and see if there are any other questions here that maybe I missed here. You know, with the dangers too, going back to that, I would say just I know with Ventosas, and it can be funny too. Like I had, like, I think one of my family members, when I talked about like this workshop and cupping in general, they said, oh, my friend's family, one of them saw a video on YouTube, you know, and then they did the Ventosas, a cupping on someone, and it did help, you know. But I also think sometimes, like, it's good to empower ourselves and to do things like that. But just, of course, with like safety in mind, you know. So a lot of times when people are doing things like that, where they will either use like a different medium other than alcohol. I think they told me they used hand sanitizer to soak the cotton ball. And so, yeah, that's when I said, well, I don't know if that's really safe. I don't have experience with that, but I would think that there's other chemicals in the hand sanitizer other than alcohol that might cause some danger there. And also I've heard of people that, you know, just kind of are doing it like with their family and don't have a lot of, you know, professional or whatever experience you want to say, using it with like a tea light or a candle as the flame, and then you put it out like that. And that I think can be somewhat safe, but if you're not maybe properly putting something under the skin for a possible burn that may happen, or just being cautious of that, of thinking like of a plan of, okay, well, what if they do get burned, you know, or something, the flame gets out of control, having like a bowl of water or something safely nearby that you can maybe put something out if it gets out of control. So that's the main thing I would mention with that there. And then someone did ask if there are any introductory books that I would recommend. That's a good question too. You know, that the links that I have at the end here, I'll show on the screen too, or we can show in a couple minutes screen share again. I would recommend maybe some articles more than books first, because I really couldn't find any books at the moment that were more kind of introductory. They were more like for people that have been studying or practicing it for a while. But what I can do too is we can send something out, or maybe put something out on the website later if I do find something, or if people want to contact me, I'd be happy to look into that more for people. Yeah, I love The Web That Has No Weaver. That was one of the first books that I read about acupuncture and Chinese medicine, and I think it's a really, really great introductory book. I just read it so long ago, Bridget, that Bridget just sent a question asking about a book called The Web That Has No Weaver, which is, I would recommend it to everybody to just get an introductory kind of understanding of Chinese medicine and acupuncture specifically. But I read it so long ago that I'm not recollecting the information that they have about cupping. So if you remember off the top of your head, Bridget, or if you know that they do have some stuff on cupping and that it's good information, I'm sure it is, but I just don't remember about that specifically. But that's a great book. I love it. And then so here we're screenshotting. Thank you again, Tabitha. The links and the resources that I used. There's a lot more that I read about or that I've read in the past, of course, that has influenced or helped my learning, my journey. But these are the ones that directly influenced this presentation and this workshop today. So we'll leave that up for, I think, for a little bit if anyone wants to write any of that down, or if you have any more questions too. while we have that up, I'll look through the chat again and just make sure that I didn't miss any questions here. Okay, and then I did miss this message that for the demos, the videos that I sent or that I recorded earlier, there are 2 of them. We can send them out to people in an email after the session, so that'll be great. So thank you. Oh, and Sylvia, I missed that message too about saying something about the wind. So yeah, go ahead, please. If you're still here. Sorry about that.
Sorry. Yeah, that was way back at the beginning, and I don't remember exactly what you were talking about. If you remember, I can, but I don't remember.
Oh, I'm so sorry. Okay,
That's okay.
Okay. If you remember though, just hop in here again. Sorry about that. Okay. I'm just gonna look through a little bit more that I didn't get a chance to look through earlier. I think that was all the questions in the chat. And then there was another question here. Should we be familiar with Chinese meridians to practice Ventosas? I don't believe that you need to be to practice Ventosas. A lot of it I feel is very intuitive and based on like our own knowledge that we have, that we carry from the past, from our ancestors in a lot of ways. We just have been disconnected from that due to many factors. So, the man that I did bring up, that man from Australia, that's kind of known as a renowned historian and expert in many ways. That is one thing I really do like about what he says, is that he really likes to give this this medicine or this therapy and kind of diffuse a lot of that stuff that I think a lot of us have in us, that we think only professionals can use these things, So yeah, I do think that with safety factors in mind, I do agree with a lot of that, saying that, really anybody could use these, and the more the better, of course. But I don't believe that one needs to know or have an extensive knowledge about Chinese medicine, or know, even the points that you're using, because we're really the main experts about our own health, about our own bodies. And so going to get help with a professional, of course, it's a lot of times it's needed, but for things like this, I think common sense and logic and our own internal knowledge is a lot of times what we need maybe for that moment. So I hope that answers that. Okay, well, I think we can go ahead and take that slide, that last one off, Tabitha, when you're ready. And then I will, let me see, I would just wanted to conclude with, yeah, just saying again how grateful I am to have this space with everybody. And thank you for giving me the time to share what I know about this, and also just share your questions and your own knowledge about